51. A patient with type 1 diabetes can develop insulin resistance over time. True or false? Answer: true. Rationale: while type 1 diabetes is primarily due to insulin deficiency, some patients develop insulin resistance, often related to obesity or puberty, requiring higher insulin doses for control. 52. A blood glucose of 65 milligrams per deciliter in a diabetic patient requires no intervention if asymptomatic. True or false? Answer: true. Rationale: a blood glucose of 65 milligrams per deciliter is below the normal range, 70 to 130 mg/dl, but asymptomatic patients may not need immediate treatment unless trending lower, though monitoring is advised. 53. Metformin increases the risk of hypoglycemia when used alone. True or false? Answer: false. Rationale: metformin works by reducing hepatic glucose production and improving insulin sensitivity, not stimulating insulin release, so it rarely causes hypoglycemia as a monotherapy. 54. Hyperglycemia can cause fatigue in diabetic patients. True or false? Answer: true. Rationale: hyperglycemia leads to dehydration and reduced cellular glucose uptake, causing fatigue, a common symptom requiring glucose control to resolve. 55. Patients with diabetes should use lotion between their toes to prevent dry skin. True or false? Answer: false. Rationale: lotion between toes can trap moisture, increasing fungal infection risk in diabetic patients, who should keep interdigital areas dry. 56. Insulin Lispro should be administered 30 minutes before meals. True or false? Answer: false. Rationale: Lispro, a rapid-acting insulin, is given within 15 minutes before or immediately after meals to match postprandial glucose spikes effectively. 57. Diabetic ketoacidosis, DKA, can be triggered by missed insulin doses. True or false? Answer: true. Rationale: missed insulin doses in type 1 diabetes lead to uncontrolled hyperglycemia and ketone production, precipitating DKA, a life-threatening condition. 58. A patient with a blood glucose of 200 milligrams per deciliter before bed should skip their snack. True or false? Answer: false. Rationale: a bedtime snack may still be needed to prevent nocturnal hypoglycemia, especially if on insulin, but the snack should be balanced to avoid worsening hyperglycemia. 59. Continuous glucose monitors, CGMs, eliminate the need for fingerstick tests entirely. True or false? Answer: false. Rationale: while CGMs reduce fingerstick frequency, many require occasional calibration or confirmation tests, especially for treatment decisions like insulin dosing. 60. A patient with a diabetic foot ulcer should walk barefoot to air out the wound. True or false? Answer: false. Rationale: walking barefoot increases trauma and infection risk in diabetic foot ulcers, which require protection and offloading to heal properly. 61. Type 2 diabetes is always preventable with lifestyle changes. True or false? Answer: false. Rationale: while lifestyle changes reduce type 2 diabetes risk, genetic and environmental factors mean it's not always preventable, though onset can often be delayed. 62. A blood glucose of 400 milligrams per deciliter requires immediate insulin administration in all diabetic patients. True or false? Answer: false. Rationale: hyperglycemia of 400 milligrams per deciliter requires intervention, but the approach depends on the patient's condition, type of diabetes, and ketone status, not always immediate insulin. 63. Insulin glargine provides basal insulin coverage for up to 24 hours. True or false? Answer: true. Rationale: glargine is a long-acting insulin with a duration of up to 24 hours, providing steady basal coverage to maintain glucose stability. 64. Hypoglycemia can cause seizures in severe cases. True or false? Answer: true. Rationale: severe hypoglycemia, e.g., below 40 milligrams per deciliter, can impair brain function, leading to seizures if untreated, requiring urgent glucose elevation. 65. Patients with diabetes should avoid all forms of sugar completely. True or false? Answer: false. Rationale: moderation, not elimination, of sugar is advised, with focus on complex carbohydrates and glycemic index to maintain stable glucose levels. 66. Diabetic retinopathy only occurs in patients with type 1 diabetes. True or false? Answer: false rationale. Diabetic retinopathy affects both type 1 and type 2 diabetes patients, caused by chronic hyperglycemia damaging retinal blood vessels. 67. A patient with a blood glucose of 85 mg per deciliter before exercise should eat a snack. True or false? Answer: true rationale. A glucose of 85 mg per deciliter is near the lower limit, and exercise may cause hypoglycemia, so a carbohydrate snack helps maintain safe levels. 68. Insulin detamere can be administered intravenously in emergencies. True or false? Answer: false rationale. Only regular insulin is safe for use in emergencies like DKA. Detamere, a long-acting insulin, is for subcutaneous use only. 69. HbA1c should be checked monthly to monitor diabetes control. True or false? Answer: false rationale. HbA1c reflects 2 to 3 months of glucose control, so it's typically checked every 3 to 6 months, not monthly, to assess long-term management. 70. A patient with diabetic neuropathy can safely use heating pads on their feet. True or false? Answer: false rationale. Neuropathy reduces sensation, increasing burn risk from heating pads, which can lead to undetected injuries or infections in diabetic patients. 71. Sulfonylureas like glympyride can cause weight gain. True or false? Answer: true rationale. Sulfonylureas stimulate insulin release, which can promote fat storage, leading to weight gain, a common side effect requiring monitoring. 72. A blood glucose of 150 mg per deciliter 2 hours after a meal is within target range for diabetic patients. True or false? Answer: true rationale. Postprandial glucose below 180 mg per deciliter is generally acceptable for diabetic patients, indicating good control, though targets vary individually. 73. Insulin pumps are only used in type 1 diabetes. True or false? Answer: false rationale. While common in type 1 diabetes, insulin pumps are also used in some type 2 diabetes patients requiring intensive insulin therapy for better control. 74. Hyperglycemic hyperosmolar state, HHS, is treated primarily with glucagon. True or false? Answer: false rationale. HHS is treated with 4 fluids, insulin, and electrolyte correction to address hyperglycemia and dehydration, not glucagon, which raises glucose. 75. Patients with diabetes should trim their own calluses to prevent foot complications. True or false? Answer: false rationale. Self-trimming calluses risks injury or infection, especially with neuropathy. Professional care by a podiatrist is safer for diabetic patients. 76. A blood glucose of 50 mg per deciliter can cause confusion in a diabetic patient. True or false? Answer: true rationale. Hypoglycemia below 70 mg per deciliter, especially at 50 mg per deciliter, impairs brain glucose supply, leading to confusion, requiring immediate treatment. 77. Insulin aspart is a long-acting insulin used for basal coverage. True or false? Answer: false rationale. Aspart is a rapid-acting insulin for mealtime or correction doses, not basal coverage, which is provided by insulins like glargine or detamere. 78. Diabetic nephropathy can be detected early with urine albumin tests. True or false? Answer: true rationale. Microalbuminuria testing detects early kidney damage in diabetic nephropathy, allowing interventions to slow progression. 79. A patient with type 1 diabetes should stop insulin during illness if unable to eat. True or false? Answer: false rationale. Insulin must continue during illness to prevent hyperglycemia or DKA, with adjustments based on glucose and ketone monitoring. 80. GLP-1 agonists like exenatide can slow gastric emptying. True or false? Answer: true rationale. GLP-1 1 agonists slow gastric emptying, reducing postprandial glucose spikes, a key mechanism in type 2 diabetes management. 81. A blood glucose of 250 mg per deciliter requires ketone testing in type 1 diabetes. True or false? Answer: true. Rationale: glucose above 250 mg per deciliter in type 1 diabetes may indicate insulin deficiency, and ketone testing helps detect early DKA risk. 82. Diabetic patients should avoid checking blood glucose during the night. True or false? Answer: false. Rationale: nighttime glucose checks may be needed, especially for insulin users, to detect and prevent nocturnal hypoglycemia or hyperglycemia. 83. Regular insulin peaks 6 to 8 hours after injection. True or false? Answer: false. Rationale: regular insulin peaks at 2 to 4 hours, making it suitable for postprandial glucose control, not 6 to 8 hours, which is typical for NPH insulin. 84. A patient with a diabetic foot ulcer should use antibiotic cream without consulting a provider. True or false? Answer: false. Rationale: antibiotic creams require provider guidance to ensure appropriate use, as improper treatment can worsen diabetic foot ulcers or delay healing. 85. Hypoglycemia is more common with metformin than sulfonylureas. True or false? Answer: false. Rationale: sulfonylureas stimulate insulin release, increasing hypoglycemia risk, while metformin does not, making it safer in this regard. 86. Diabetic retinopathy can lead to blindness if untreated. True or false? Answer: true. Rationale: untreated diabetic retinopathy damages retinal vessels, progressing to vision loss or blindness, underscoring the need for regular eye exams. 87. A blood glucose of 90 mg per deciliter before a meal requires treatment in type 1 diabetes. True or false? Answer: false. Rationale: a premeal glucose of 90 mg per deciliter is within target range, 80 to 130 mg/dl, requiring no immediate treatment, though meal insulin may be needed. 88. Insulin pens should be stored in the refrigerator after opening. True or false? Answer: false. Rationale: opened insulin pens can be stored at room temperature for up to 28 days, improving convenience while maintaining potency. 89. Exercise can improve insulin sensitivity in type 2 diabetes. True or false? Answer: true. Rationale: exercise enhances muscle glucose uptake, reducing insulin resistance and improving glycemic control in type 2 diabetes. 90. A patient with type 2 diabetes always requires insulin within 5 years of diagnosis. True or false? Answer: false. Rationale: many type 2 diabetes patients manage with lifestyle changes or oral medications for years, with insulin needed only if control worsens. 91. Kussmaul respirations are a sign of hypoglycemia. True or false? Answer: false. Rationale: Kussmaul respirations occur in DKA, a hyperglycemic complication, as the body compensates for acidosis, not in hypoglycemia. 92. A patient with diabetes should check their HbA1c daily to monitor glucose control. True or false? Answer: false. Rationale: HbA1c monitors long-term, 2 to 3 months, glucose control and is checked every 3 to 6 months, not daily, unlike blood glucose tests. 93. Insulin NPH is a clear insulin that does not require mixing. True or false? Answer: false. Rationale: NPH is a cloudy insulin requiring gentle mixing to ensure uniform suspension, unlike clear insulins like regular or glargine. 94. A blood glucose of 180 mg per deciliter at bedtime requires immediate insulin in all diabetic patients. True or false? Answer: false. Rationale: a bedtime glucose of 180 mg per deciliter may require insulin based on the patient's regimen, but other factors like trends or ketones guide treatment. 95. Diabetic neuropathy can affect the autonomic nervous system. True or false? Answer: true. Rationale: autonomic neuropathy in diabetes can cause issues like gastroparesis or orthostatic hypotension, resulting from chronic hyperglycemia. 96. A patient with type 1 diabetes can safely fast for 24 hours without insulin. True or false? Answer: false rationale. Fasting without insulin in type 1 diabetes risks hyperglycemia and DKA due to ongoing glucose production, requiring basal insulin. 97. SGLT2 inhibitors increase the risk of urinary tract infections. True or false? Answer: true rationale. SGLT2 inhibitors promote glucose excretion in urine, creating a favorable environment for urinary tract infections, requiring patient monitoring. 98. A diabetic patient with a blood glucose of 300 milligrams per deciliter should drink sugary beverages. True or false? Answer: false rationale. Hyperglycemia requires insulin and hydration with water, not sugary beverages, which would worsen glucose levels. 99. Regular insulin can be used in insulin pumps. True or false? Answer: true rationale. Rapid-acting insulins like regular insulin or analogs, e.g., Aspart, are used in pumps for precise basal and bolus delivery, though analogs are more common. 100. Patient education on diabetes includes teaching about the importance of regular dental checkups. True or false? Answer: true rationale. Diabetes increases gum disease risk due to impaired immune responses, making regular dental checkups critical for oral health.